Hello all, this is Mrs.Lalithamani, Associate Professor from SNS College of Nursing. In this lecture series, we will be learning about the neurological disorder and its nursing management, with that comes under the adult health nursing subject. The topic will be like the meningitis, which we might have seen in the clinical setup, where the patient will be coming with neurological manifestations denoting that. So the definition is meningitis is defined as the inflammation of the meninges, which are the three membranes that are the layers that cover the brain and the spinal cord. The three layers will be the dura mater, arachnoid matter, and the pia mater. So when these three meningeal layers are being inflamed or infected with the bacteria, virus, or any other organisms, we call that as a meningitis. So the inflammation happening with the covering layers of the brain and the spinal cord, that includes the dura mater, arachnoid matter, and the pia mater, will be called as the meningitis. In the image you can see that. And the next one will be the causes of meningitis. When we tell something is happening, we need to find out why it is happening, how this happens. So we have said that is viral meningitis. Okay, so when we say that the causes of meningitis is happening, the very first thing that comes into the mind will be bacterial meningitis, second one viral meningitis, third one is fungal meningitis, parasitic meningitis, and non-infectious meningitis. So when these five components are being present, we need to find out whether the bacterial meningitis is caused by the very commonly occurring bacteria, that is Neisseria, and the streptococcus. If it is a viral meningitis, it might be because of enterovirus or herpes virus. Coming on to the fungal, that might be cryptococcus. Cryptococcus might be the reason for a fungal meningitis. Coming on to the parasitic meningitis, might be causing an angiocryptosis. And the non-infectious meningitis might be because of cancers or tumors. Then the types of meningitis, one is bacterial meningitis, viral meningitis, fungal meningitis, parasitic meningitis, and non-infectious meningitis. So when we talk about the causes of meningitis, when we were able to rule out all the 4-5 causes, the same thing will be the types of meningitis and the reflecting manifestations. So coming on to the meningitis, bacterial, viral, fungal meningitis, parasitic meningitis, or it might be the non-infectious meningitis. Then what might be the signs and symptoms of meningitis? So when we talk there is signs and symptoms, we will be able to identify that there are many signs and symptoms which will be affecting the neural response and the entire homogeneity of the body. So the person might be having a fever, neurological manifestations like so coming on to the signs and symptoms, the person will be usually having a fever, headache, that coming on to the person, there will be a stiff neck, which will be having an impact on the nervous system, spinal cord. The person might be complaining of nausea and vomiting, photophobia will be there, and altered mental status will be there. The patient will be having the skin rashes, and they will be having sleep disturbances. So all these stiffness in the motor and sensory areas, the fever, photophobia, headache, skin rashes, then stiff neck, nausea and vomiting, altered mental status, everything will be showing us something that there is a problem that is happening with the neurons and the neuroconnectivity. If a person is coming on with these manifestations, the high temperature, sudden outbreak will be there. The person might be having severe nausea and projectile vomiting, and the stiff neck, the person might not be able to bend and extend the neck. And photophobic manifestations, as we all know, their person will not be able to look into the light. Then there are two classical manifestations which will be denoted as the signs of meningitis. One is Kerning sign and another one is Brudzinski sign. So the Kerning sign is something like the knee extension is painful. When the simple mnemonic to remember will be the knee extension will be painful. That is called as Kerning sign. So when we talk that Kerning sign, we ask the patient to lie supine with the hip flexed, and we may ask the patient to flex the flex and the extend. So the patient may be able to flex the knees at the knee joint and not the hip joint, but when the knee is being extended, it will be causing painful. And the Brodinski sign will be like the person however there will be the neck flexion leads to knee flexion. When the patient is asked to when we flex the neck, when the patient is lying in a supine and when we flex the neck, the neck flexion will be causing the hip and knees also to get flexed. When you bend the neck, when the patient is lying down, the hip and knee will get flexed. So far we have seen about meningitis, the definition, types of causes of meningitis, clinical manifestations, and we have seen about the Kerning sign and Brodinski sign, which will be the key or the unique clinical manifestations that are very specific. The diagnostic finding, confirmatory diagnosis can be done with that. Thank you until then.